Hello everyone, welcome back to my channel. Today we are going to discuss the part 11 of our clinical case scenario series. So let's begin our today's lecture. So here we have the MCQ number 51. A patient presents to the clinic with the right shoulder pain and complains of difficulty reaching overhead with pain especially from 60 to 1 degree of shoulder flexion. So which special test would be the most informative for the set of the symptoms? Option A, Neer's test. Option B, Ambitican test. Option C, crossover test. And the option D, push-off test. And the correct answer is option A, Neer's test. Let's see the explanation. In the case of Neer's test, which is the test for subacromial impingement and is typically associated with the painful arc. In the Ambitican test, which assesses the supraspinatus pathology. On the other hand, in the crossover test, which check the acromoclavicular joint pathology, and in the end, the push-off test assesses the strength and the integrity of the subscapularis muscle, which is one of the rotator cuff muscle. Moving toward the scenario number 52, a physical therapist is evaluating a patient with the pain that radiates throughout his lower extremities. The patient has significant foot drop while ambulating and complains of numbness and tingling that is extending from the greater toe up to the knee along the anterior leg. So what is the most likely pathology underlying these symptoms? Option A, sciatic nerve entrapment. Option B, deep peroneal nerve inflammation. Option C, tibial nerve entrapment, and the option D, L5 nerve root entrapment. And the correct answer is option D, L5 nerve root entrapment. Let's see the explanation. In the tibialis anterior muscle weakness and the sensory loss along the anterior leg below the knee, which is the most common sign of L5 nerve root entrapment. On the other hand, in the case of sciatic nerve entrapment, that can occur and cause the symptoms that radiate down toward the posterior leg, and it does not cause foot drop. In the case of deep peroneal nerve, that only innervate the small portion of the dorsum of the foot, so it does not usually cause the foot drop and the sensory loss. And at the end, the tibialis anterior nerve entrapment that would affect the posterior leg that is extending to the heel. But in the case of tibial nerve entrapment, there will be no sensory loss. Only the motor loss would be present in the plantar flexors. Now moving toward the MCQ number 53. A physical therapist is performing a treadmill exercise stress test using the Bruce protocol. During the stage 3 of the Bruce protocol, the P wave increase in height and the ST segment begin to become significantly upsloping. So what is the most appropriate course of action? Option A, stop the test and refer the patient to the physician. Option B, lower the stage back to stage 1 and monitor for improved ECG. Option C, continue with the test without any modification and monitoring the patient for the symptoms of cardiac distress. And option D, discontinue the test and monitor the patient's vital sign for 10 minutes. And the correct answer is option C, continue with the test without any modification and monitoring for the symptoms of the cardiac distress. And here we have the explanation. In the case of Bruce protocol, for an exercise stress test involves using the 12-lead ECG monitor to evaluate the amount of stress that is placed on the heart. You would stop the test if there was ST elevation or depression. But if the ECG shows the P wave increase and the ST upsloping, so this will be the normal response in the stress test. So we will not stop the test. Moving toward another MCQ, a 12-year-old male athlete that is being evaluated by the physical therapist. The patient reports pain with running and has a sharp pain over the patellar tendon, that particularly on the tibial tubercle. So which of the following disorder is the most likely present? Option A, leg calf Perthes disease. Option B, chondromalacia patella. Option C, Osgood-Schroeder disease. And option D, pes enserine bursitis. And the correct answer is option C, Osgood-Schroeder disease. And here we have the explanation. In the Osgood-Schroeder disease, which is characterized by the painful bump over the tibial tubercle and it causes the pain with sporting activities. This is most common in the young children who are very active in sports, particularly males. On the other hand, in the case of leg calf perthes disease, which is characterized by the loss of blood supply to the head of the femur and subsequently cause bone death, the cause is often unknown and is typically occur in boys from 4 to 10 years old. In the case of chondromalacia patella, which is characterized by the cartilage loss and disturbance in the underneath of the patella, which is the evidenced by pain with knee motion, but not the painful tibial tubercle. And at the end, in the case of pes anserine bursitis, which is characterized by the pain at the insertion of the sartorius, gracilis, and the semitendinous muscle, which is medial to the tibial tubercle, at least 3 to 4 centimeters. So now moving toward the last MCQ of today's part, a patient has just undergone a total hip replacement via a posterior surgical approach. So which of the following combination of movement of the hip are most important to avoid? Option A, extension, medial rotation and abduction. Option B, extension, external rotation and adduction. Option C, flexion, medial rotation and adduction, and the option D, flexion, external rotation and abduction. And the correct answer is option C, flexion, medial rotation and adduction. Let's see the explanation. So flexion, medial rotation and the adduction, these are the standard precaution to avoid the dislocation with the total hip replacement or the total hip arthroplasty that use a posterior surgical approach. So that's all for today. Thanks for watching.